Thanks so much for inviting us to talk about Ebola virus disease. And this is a condition which is not appearing here for the first time. And although we've had multiple outbreaks over the last 20 years, this particular Ebola virus type, known as the Ebola Sudan virus, is making its third appearance in Uganda. And the last reported case was in Luwero in 2011. The outbreak is still evolving, and as of 2 days ago, we had reported about 48 cases nationally, 17 had succumbed, and we had about 31 patients in admission. And this condition is peculiar because unlike another closely related virus that you studied extensively, the Ebola Zaire virus, for this one, we don't have any licensed vaccine, no licensed therapeutics, no field diagnostics. So I always say, imagine in early 2020 when COVID had just started, that would be a similar situation that we are in. This is a highly transmissible disease, which we call a zoonosis, meaning it begins in animals, and then you have one incident where a human interacts with a dead animal or a live one that is infected, and then the virus is passed on. And once it gets into the human population, it gets amplified, and that's how we have outbreaks. The virus can survive on surfaces, including medical equipment, tables, and furniture, but specifically in body fluids, including blood, vomit, urine, stool, sweat, and sexual fluids for up to 14 days if not managed. Despite being highly infectious, I think it's critical for us to define the risk for getting this disease. And unlike COVID-19, those who are at highest risk of contracting the disease are those who are in close proximity to the patient or who are in contact with the patient's environment. And that means healthcare workers and family of a given patient are the highest risk. However, as a healthcare worker, if you practice safe infection control measures, then you yourself are not at an increased risk of contracting the disease. And it also poses little risk to travelers or to the public who have not been at settings where patients or people who have died of Ebola virus are being managed. In a setting where we do not have vaccines or other medical countermeasures, then prevention is the best and most efficacious approach. And IPC, or infection prevention and control, is critical because it enables us to protect healthcare workers who are a critical resource for the health system. And by protecting healthcare workers, then we are able to sustain or mount a successful response and continue essential services. So that's why this module at this time is quite critical. Infection control is a subject that has gathered attention at least over the last 15 years. And basically, it's a set of evidence-based practices, which when used consistently, can help us alleviate the risk of acquiring infections in the course of seeking healthcare. And by doing this, they prevent transmission or reduce the risk of transmission of microorganisms healthcare providers to patients, residents, and visitors. You will hear a concept known as the chain of infection, which basically looks at the key thematic areas that must come together for successful transmission of a disease to happen. And by breaking any of these chains, then we can stop transmission. So we look at how we will break this chain in the context of Ebola virus disease. In IPC, or in occupational health, there is a concept known as hierarchy of controls, meaning it's an inverted pyramid that has different measures that an individual or a system can deploy to mitigate the risk of infectious diseases. We have elimination and substitution at the top, which means basically removing the hazard or the risk from our environment. And you will hear of screening, or you have heard that, for example, the US is currently directing all travelers returning from Uganda to specific airports so that they can keep the threat at bay. Or we can even find alternative ways of providing care or giving service, which reduce the risk of potential transmission. After that, we have engineering controls, which are walls or using barriers and space to restrict access, and restructure staff and patient movement so that people do not move in an area where people who are at risk of contracting or transmitting this infection do not interact. Then we have administrative controls, which is specifically changing how people work, use SOPs, train, and modify any staffing ratios to ensure safety. And lastly, we have what we call personal protective equipment, which is the last line of defense and the least effective, meaning PPE needs all these other elements in place for it to work. In healthcare, we talk of a concept known as standard precautions, meaning these are precautions which must be observed by all healthcare workers at all times, regardless of the patient's infection risk. And these include hand hygiene, respiratory hygiene, appropriate use of personal protective equipment, safe waste management and injection safety, proper linen management, and environmental cleaning and sterilization. In the context of routine care, hand hygiene, or even in the context of Ebola virus disease, hand hygiene is the most efficacious and most cost-effective intervention for preventing spread of infections. And WHO has proposed a framework of the 5 moments of hand hygiene, which we should follow to minimize the movement of infection from one patient to another. Meaning the encouragement is we should wash hands before touching a patient, before doing a clean or an aseptic test, after exposure to body fluid, after contact with the patient surroundings, and after patient contact. Respiratory hygiene is a concept which is well known, especially from the COVID days. And we also know that beyond COVID, diseases like Ebola can also be transmitted through droplets, though this time not through coughing primarily, although that risk is there, but because Ebola patients have a lot of vomiting and diarrhea, there is a risk of droplets generated through splashing. So we still encourage this measure to encourage people to cover their nose and mouth when they are coughing or sneezing. And we use the mantra of catch it, meaning cover your mouth with a tissue, clean it, cut that tissue which you have used, and kill it. Wash your hands to kill off any germs that could have made it to your hands. We should still avoid crowding, or what we used to call social distancing, and use medical masks or offer medical masks when you are in crowded spaces. Transmission precautions, these are additional measures we take once we have understood the mechanisms of how a disease is spread. And for Ebola, it is predominantly through contact, meaning now that we know how it's spread, we need to protect ourselves by using precautions that protect our hands and our body when we are interacting with patients. So we recommend use of gloves, full body coverage using a coverall or a gown, and then protection against the droplets using face masks, and also covering eyes using face shields or goggles. Use of personal protective equipment is what I call a motor skill, meaning you do not learn how to use PPE by sitting in a class or watching a video, because it's something that you have to practice personally for you to appreciate. So in a nutshell, this is a general picture of what the PPE should look like, meaning if you are in a healthcare setting and you are a healthcare worker, once you are in what we call a green zone or low risk area, at least have closed shoes or gumboots, have scrubs instead of your home clothes, and also recommend use of a face mask since COVID is still here. If you're at a screening area where you are interacting with patients, we recommend a gown, gloves if you're going to make patient contact, a face shield, and a face mask. And once you're going into the red zone, or what we call the high-risk area, then you put on the full advanced PPE as shown in this picture. I won't try to go through everything because, like I said, this is a motor skill which you learn by doing. This table still summarizes some of the risk assessment guided PPE selections, meaning choosing PPE when you are close but not in contact with a patient, when you are in close and in contact with the patient or their environment, and then also particularly when you are in the patient's environment, but are doing tasks which require a lot of effort, like lifting equipment, lifting patients from wheelchairs onto a bed, or cleaning. And in that case, we even recommend use of heavy-duty personal protective equipment for additional protection against tearing of your personal protective attire. Cleaning and disinfection is also another standard precaution. And here mainly we talk about mixing disinfectants for cleaning the environment, management of linen, waste management, and management of infectious spills. Most of these are tasks which should be executed using standard operating procedures to ensure consistency of the process. But also it makes it easier to train people, even when you have new people joining your team at any given time. We recommend paying particular attention to what we call high-touch surfaces, meaning when you are advising your cleaners or even setting up your area for the day, pay particular attention to areas like your worktops, doorknobs, water switches, and medical equipment, because those are the ones that people are likely to soil and leave germs that you could pick up and end up transmitting to yourself or to others. So pay particular attention to those high-touch surfaces. Make sure that all surfaces are cleaned and allowed to air dry, because dampness will allow this virus to survive for longer. And this is not just for Ebola, but also other bugs that we call gram-negative bacteria, which cause hospital-acquired infections. The one new practice or one new recommendation that has recently emerged is the fact that we should no longer recommend spraying of disinfectants, but rather we should wipe, because spraying indeed uses a lot of disinfecting solution, but also does not give us empirical evidence that you've covered all the supplies. So even as you prepare, request for supplies that encourage more of wiping rather than spraying. So additional measures to take to ensure adequate environmental cleaning when you're setting up your patient care areas: minimize any redundant equipment in the patient areas. This includes also belongings of the patient, so that cleaning is done more effectively. The patient room should be cleaned at least twice daily, and then use of available disinfectants like sanitizer, which is alcohol that has at least 70% concentration, or even bleach solutions ranging from as low as 0.05% are effective in neutralizing the virus. For waste management, the principles remain the same, but the one key element in the context of Ebola virus disease is that all waste which is coming from the patient care area, generated from the process of care, or even from the routine activities of the patient, like eating, is classified as high risk waste. meaning it should be segregated in what we have as the red coded waste bins, so that it can be, treated in the same caliber as placentas and, heavily soiled gauze, for example. Pay particular attention to sharps.